Hello to the people that are joining. You are joining the webinar for the 2024 Health Tech Global Case Writing Competition. We're just waiting a few moments for more attendees to get online. So we will begin the webinar shortly. Okay, we'll get started. Hello and welcome to the informational webinar for our 2024 Health Tech Global Case Writing Competition. This webinar is entitled Competition Overview and Case Writing Tips. My name is Sandy Draheim, and I'm the manager of WDI Publishing, part of the William Davidson Institute at the University of Michigan. I will be one of the presenters today, along with Pascal Louet, WDI's Vice President Healthcare, and Johan Clayton-Jones, WDI's Senior Director Healthcare. Before we begin today, just a bit of housekeeping. If you have a question during the presentations today, please send it within the Q&A function in Zoom, and that Q&A button is located next to screen share, just so you know where that is. We will try to answer as many questions as possible, both during and after the presentations today. We'll also aim to keep this webinar to less than 1 hour. And you probably noticed when you logged in today that this webinar is being recorded. Within about 24 hours, a link to the recording will be made available on the Health Tech Case Writing Competition website on the resources page. And the recording will also be emailed directly to everyone who registered for the webinar. This is our agenda for today. First, Pascal and Johan will briefly cover WDI's work in healthcare technology innovation and discuss why this sector is so important to low and middle income countries. After that, I'll provide an overview of the competition, and we'll then present what I hope are helpful case writing tips. Again, we will answer questions both during and after the presentations today, and we'll try to address them as they're sent to us in the Q&A function of Zoom. Once again, welcome to everyone that's joined us today. And at this time, I'd like to introduce Pascal.
Sandy, would you be able to advance the slide? So hi, as Sandy said, my name is Pascal Louet, and I'm going to give you a little bit of an introduction to what the William Davidson Institute at the University of Michigan does. So we are an independent nonprofit organization that's housed within the University of Michigan's Business School. And our mission is to equip economic decision makers in emerging countries with the tools of commercial success, because business drives economic growth and social freedom. We've been around for about 30 years. And during those 30 years, we do a number of things. We work with our clients on consulting projects, research projects, and on training projects. We work with both for-profit and nonprofit clients, and we're entirely focused on low and middle income countries. So the areas of work that we work on, there are 4 sectors. So healthcare, which is the one we're talking about today, education, energy, and finance. And we're supported by 2 cross-sector resources, the performance measurement and improvement, and communications, including Next Billion, as well as case publishing. So that's generally speaking what we as the William Davidson Institute does here at the University of Michigan. On the next slide. So so what do we do, and why are we great at what we do at the University of Michigan's health within the Health Institute health area? So there's 4 things we bring to the table. The first is a business lens. So as I mentioned earlier, we are housed within the business school, which means when we look at a problem, whether it's healthcare or energy or any other problem, we look at it through a business lens. So we think about financial sustainability, and we think about who our customers are, who our customers are, who our clients are, and how we're going to get those products and services to the people that need it the most. The second thing that we bring to the table is a deep expertise across the healthcare value chain, as well as the supporting systems. When I mean the healthcare value chain, I mean from all the way from the research and development that you might need for an individual product, all the way to the delivery of that product at the clinic. So in healthcare delivery, basically. We've got 30 years of experience within that space. The third is a strong network with people. A strong network with people and organizations working in LMICs. And when I say organizations here, I'm talking about donors, for-profit and nonprofit organizations that are both in the countries that we're working in, as well as outside of those countries, so in OECD countries. We also have a very strong network within the University of Michigan, not surprisingly, so we can draw on the expertise of world-class researchers across the different disciplines within the university. And then finally, of course, the experience of 30 years. So we have had hundreds and hundreds and hundreds of projects that we've worked on with clients that we've now known, again, for decades. Some of them are brand new, but we bring a great deal of experience within that healthcare sector. With that, I'm going to pass off to my colleague, Yuan.
Thank you very much, Pascal. Good morning and good afternoon, everyone, depending where you are in the world. I'm going to just take you a little deeper into some of the aspects of what we actually help clients to answer in the area of healthcare. So most of the work revolves around strategy or operations, or it's training. A lot of the training revolves around strategy and operations as well, but sometimes other aspects as well, finance and so forth. And these often relate to health technology, particularly in operations. We make a lot of use of health technology in the improvement of operations, or improving, getting them to be more efficient. And even in some of the training we do relates directly to health technology. As a micro example, we have a project where we actually do training in country in West Africa with banks and with private sector healthcare businesses. Many of them are small private hospitals and clinics, on how to finance their health technology park. So specifically their medical equipment. So we teach the banks how to evaluate such financing proposals, and we teach those who are applying for finance how to figure out what equipment they need, how to procure it, and how to apply for the finance that they need in order to get that equipment and get that technology working in their healthcare operations. So that's a micro example. So just looking at these, so in strategy, what kind of questions do we help clients to answer? Things like what market they should enter, what the strategy should be for that market entry, where should they invest. In operations, these are just a couple of examples, but actually there's almost no, well, there is really no aspect of operations on which we have not at some point consulted as William Davidson Institute. But a lot of this is around how to improve efficiency of various systems, particularly around the delivery of care and the things that back up the delivery of care, such as the supply chain, how to finance the projects that are undertaken to deliver care, and also how to analyze care processes, how to make them more efficient, and how to cost them. There are particular ways to cost them, and some of those techniques actually count as technology as well. They are aspects of what's used in management to get it right, basically, and to understand what it costs you to deliver your care so you can price it appropriately and so forth. And then we also help clients to understand how their systems need to change as their organization grows. If you go from one clinic or one hospital to having multiple, you need very different systems in order to manage that. And most of those systems run on various types of technology that enable them. And so there's an awful lot of technology involved in the delivery of healthcare. And it ranges from medical equipment all the way through to management techniques. There's just so many different aspects of tech involved in the delivery of care. And then we have a toolbox of different items, different capabilities that we have that we can assist clients with. And these include the ability to analyze markets, financial analyses, demand forecasts, how to model what operations are going to look like and what the financial projections are going to look like. We do observational studies, and we interview key stakeholders and analyze what the risks are. Some of the work we do is for banks and private equity funds and so on that are investing into healthcare in low and middle income countries, and helping them to understand their risks so that they can go ahead and make those investments and get that capital mobilized and increase the availability of care for patients. Chris, could you advance us to the next slide, please? And briefly, just an overview of who our healthcare-related clients are. We have both for-profit and non-profit clients. All our work is focused on and has to relate to the private sector. But occasionally we have clients who are maybe government or multilateral organizations, but the subject of their work or the beneficiaries of their work are in the private sector. So our for-profit clients include multinational companies, as well as domestic companies based in specific countries, low and middle income countries. And many of them are hospitals and clinics, but some of them are, medical equipment suppliers, banks, and so forth. We also have not-for-profit clients, and these include both bilateral and multilateral organizations, so USAID, and groups like International Finance Corporation, that's part of the World Bank. We also work with global donors such as the Global Fund, foundations such as the Gates Foundation, and as well as non-profit hospitals and clinics domestically in country, in low and middle income countries. With that brief overview for you of our work, I would like to hand it back to Sandy to talk to you more about the case writing competition.
Thank you very much, Johan and Pascal. We appreciate your time and your presenting of some really informational content to us today. Now I'd like to start the competition overview part of the webinar. And as I start the competition overview part of the webinar, I will actually start with the competition objectives, which are to encourage and reward development of new business case studies that focus on new health-related technology innovation that is appropriate for low and middle income country settings. Another objective is to publish higher education case studies that will help develop the necessary student critical thinking skills regarding the unique health-related technology needs of LMICs. And third, to accelerate global knowledge of health-related technology innovations being implemented by businesses and LMICs. I think it's probably apparent by now that the topic of our case writing competition is health technologies. Specifically, the topic of your case should be about a novel product or service appropriate for an LMIC setting that also contributes toward improving, maintaining, or monitoring the health of a given population. There are a variety of ways for you to write about health technology and LMICs in a business case study format, and I'd just like to give you some brief examples of ways you might do that. And you might do that in every example you might use all the examples I'm going to provide to you. Since case studies must have a protagonist, this person could be an individual heading up a launch of a new product in an LMIC that features technology to better manage patient data in real time instead of relying on, for example, hard copies anymore. Quite possibly the dilemma or decision point within your case could be focused on how to best use a new service technology to reduce the cost or improve the quality of medical care. And then, of course, the featured organization in your case is the entity where the protagonist actually works and the dilemma occurs. So the organization, it could be in the healthcare industry or even another industry where a technology is being repurposed or perhaps adapted to the health industry. Almost anyone can enter our competition, but typically they are faculty, students, or other professionals or practitioners. So university faculty, either individually or in teams, can enter. Graduate or undergraduate students, again, either individually or in teams, can also enter as long as they enter in collaboration with a faculty member. And then other professionals, as I said, and practitioners can also enter, again, but they should collaborate with a university faculty member. The reason we're asking for collaboration with faculty, if you're not faculty, is to ensure that the submitted case and the teaching note have academic rigor and sound pedagogy. And as you can see on the screen, the prize awards are $3,000 US for first, $2,000 for second place, and $1,000 for third place. We may award some honorable mentions, and honorable mentions will not receive any monetary award, but like the first three places, they will also be published by WDI Publishing. I always think it's a great idea when you're entering some type of competition to know the criteria upon which you're going to be judged. So that's what I'd like to share now. There are several categories of criteria. The first is topic content, and to no one's surprise, the protagonist and/or the case dilemma has to be clearly focused on health technology in a low and middle income country. It must have sound teaching and learning value. What that means is it really must engage students into an active learning mode and provide students with opportunities to exercise more higher order complex thinking to solve the dilemma or decision points. The introduction and overview is another criteria category. And the intro must really spark interest and curiosity of the reader, drawing them into the narrative. And it must also clearly introduce the protagonist and organization. And then the protagonist and organization, again, has to be clearly identified, and there have to be appropriate details about that protagonist and the organization so that the reader can get adequate context. Then, of course, the dilemma or multiple dilemmas in the case must be clearly described so the reader can clearly understand what is the problem to be solved in the case. Also, the dilemma must realistically be able to be solved by the reader or by the protagonist. Sometimes we get case studies that present a dilemma that's a little bit too complex to be realistically solved, and we like to stay away from that. So if we keep focused on making the dilemma solvable, that's very helpful in creating a better case. The writing and the citations and sourcing, this means that documents need to be free from any structural or grammatical, spelling or typographical errors. And there also need to be appropriate citations and endnote sources to support content in the case that needs to be attributed to some source. And finally, the teaching note. A teaching note must accompany each case that's submitted. And that teaching note has to include clear, measurable teaching objectives. The pedagogy identifies the case audience and business disciplines, prerequisite knowledge or courses that also needs to be included in the teaching note, along with the assignment questions. And teaching notes typically provide a plan for how to allocate time in class for the instructor. That's also very important in the teaching note. These are our judges for this year's competition. I'd like to introduce you to who they are. First, Emma Hannay. She is a public health doctor with a focus on global health strategy and delivery. Her work has been centered at a global level on organizational strategy in global health and access to new innovations in health. Her work is really centered on implementing health systems reforms in complex operating environments in Pakistan and the Democratic Republic of Congo. Our next judge is Dr. Matthias Ruger. He is a consultant pediatric orthopedic surgeon, and he specializes in limb reconstruction at Children's Hospital Zurich. In addition, he's a clinician scientist at ETH Zurich. In the fields of digital health and personalized medicine, he has developed a wide array of technologies and authored a number of peer-reviewed publications and book chapters. Our next judge, Praveen Suthram, is an entrepreneur and a healthcare futurist. He's the co-founder of Next Services, a company that helps healthcare organizations in the areas of administration and technology. He also co-founded Novo Liver, a wellness company that helps people manage chronic conditions. And not pictured on the screen right now is a fourth judge who we just secured late yesterday. She is from the International Finance Corporation. She's a senior health tech industry specialist, and her name is Monique Emrazak, and I probably got that last name mispronounced, and I apologize. But she will also be included in our judging team. Our process for reviews and judging will follow this process. First and second rounds of reviews will be double blind. In other words, the reviewers will not know the identity of the submitting authors and vice versa. Finalist judging will be reverse single blind, as the finalist judges will not know the identity of the submitting author, but the authors will know the identity of the finalist judges, obviously, because I've just introduced them to you, and they also are posted on the competition website. This lists a few of our submission requirements. Of course, I've already mentioned quite a few times, the topic is health tech. All submissions must include a teaching note. The cases must include a protagonist and a decision point, since this is what makes up a true business case study. It must be previously unpublished and not bound by any previous copyright. And that's because we plan to publish the winning cases ourselves. We wouldn't want to infringe on someone else's copyright. And the case and sometimes the teaching note must include citations and endnote sources with attributable sources for the information in the case. Again, if anyone has any questions as we're moving along, feel free to enter them in the Q&A. Here are the key dates for the competition. By the last day of January, January 31st, intent to enter forms are due. It's important to understand that the intent to enter forms only are due and not your final submissions on January 31st. The intent to enter form can be filled out and submitted on our competition website at the link provided here. And this particular form asks for some high-level information about the case you intend to submit. But note that your documents do not need to be completed at this time. We're asking for some information on the intent to enter form because it gives the competition administrators kind of an indication of submissions to come and gives us an opportunity to evaluate and assist you, if necessary, with certain elements of your submission. All of your documents are due by March 31st, 2024, and you will submit them by going to the link you see on the screen here and following the prompts to fill out the submission form. And this particular web page will also allow you to upload your final documents after you fill out the submission form. And then sometime in July 2024, we hope to publicly announce the winners. This slide lists resources for writing a case and a teaching note. All of them can be found on the resources page of our competition website. I really encourage everyone to review them as well as review all the pages of the site because it displays all the competition details. Most of them I'm covering today, but there may be some things I don't cover, so I encourage you to look at the website. So this ends the competition overview part of the webinar, and I will start on case writing tips, but it looks like we might have a quick question, which I'm not sure I can answer. The question is, does a device with predictive health capabilities be okay? I'm assuming that's okay is it okay for the topic of the case? And my answer is yes. It sounds like it would. So hopefully that helps. All right, case writing tips. Some of you may know that the very first Harvard published case was in 1921 and was about the General Shoe Company. It was exactly 1 page long. You can see it on the screen right now. The dilemma was that the factory workers were stopping work 45 minutes before their shift was over, which caused cascading slowdowns across the adjacent factory lines. This was happening because workers were required to wash up before leaving the plant, but because they had to wait in line for the washrooms, they could end up not being able to leave promptly at their shift's end. So they started leaving 40 minutes early, causing a problem. So cases today reflect a lot more complexity than in 1921, and are typically much longer in length, certainly longer in length than 1 page, which you see on the screen. And they often today include exhibits and tables and spreadsheet data, sometimes even audio and video elements. And today's cases also reflect the challenges of a global economy and competition, and of course, challenges related to healthcare, for example. A discussion about how to write a case study often begins with defining what a business case study is and what it isn't. So this is what a case study is. It's a teaching tool that is a story or a narrative about a decision faced by an organization, and there should never be just one answer to that decision or dilemma. Instead, there should be multiple approaches to solving the problem. A case must also have a protagonist, who is the person responsible for developing a solution or recommendation to solve the dilemma. And then also, a case has to have a defined time frame, as well as urgency and tension that kind of surrounds the dilemma, and that's usually based on the time frame. We all have dilemmas and work-related problems to solve, and I would be surprised if someone told me there was never a time frame surrounding that. And that's usually the urgency or tension. But the urgency or tension can be based on something else. For example, lives could be at stake, for example. Jobs could be at stake. And perhaps global health in general. So this is what a case study is not. A case study is not a summary of events like a news article. It's not a research paper, and it's definitely not a marketing tool. And I say that it's not a marketing tool because sometimes when cases are written about a particular organization, it's tempting for the authors to write in a very positive light and glowing terms about that organization. And sometimes we have to be careful of that because we're not writing a marketing piece, we're writing a case study that's trying to offer up a learning opportunity for a student. On this slide on this slide is a lot of information, but the top of this slide talks about what I call the 4 overarching sections of a case. So the first section is the actual title of the case, which is quite important and generally is about 10 to 12 words long. It should feature the name of the organization and allude to the dilemma in the case. I caution against titles that are too long because that's not good for search results or online displays because it will truncate those titles and it may be truncating and cutting off an important part of the title. So I urge the titles to be a little bit shorter than longer. The introduction of the case needs to identify the protagonist, the organization, the dilemma, clarify the time frame for the case. And this should all be written in a narrative style that draws the reader in by describing the tension and urgency surrounding the situation. Next is the section, just what I call background. And this is probably the longest section of the case. This background information presents all the relevant facts and data. Examples include industry information, history of a company, such as the number of employees, the locations, products, services, financials are often included in this information, competitors, customers, and sometimes just specific geographic locations. And then the conclusion of the case should restate the dilemma, the time frame, and the urgency. And often a conclusion presents actual questions that the protagonist must answer. And it's okay to do that. Excuse me. There are other parts of a case listed on this slide. Exhibits, tables, and appendices. These are what I call visuals or the graphics that can be included in a case. I remind you that any exhibits, tables, appendices, figures, they all have to have sourcing listed beneath the image. We need to know where they came from or if you created them yourself as the author. If you did create it yourself, we just say created by the case author, and that's fine. But if you acquired the information and just created the graphic and put the information in that you found somewhere, then we need it sourced, where you pulled the information from. Citations and endnotes. Citations are the consecutive superscript numbers that appear within the text of your documents. And they refer to the same number at the end of the case that provides the full source for that citation number. And sometimes it's easy to get endnotes and footnotes confused. Endnotes are sourcing information at the end of the case. Footnotes are at the bottom of the page where they're further explaining something that's on that page. I encourage you to review the WDI publishing document, How to Write a Business Case. It provides a lot more details than I could fit on this slide, and it would be very helpful to you. For the teaching note that needs to accompany your case, it also has several sections to it, and I'd like to briefly review those right now. Remember that the teaching note is written for the instructor or professor so that they can really understand how to teach the case to their students. When you're writing the case, you're not writing to anyone in particular, but you're writing as if the student is reading and learning from it. The teaching note is written exclusively for the instructor or faculty member teaching the case. So first should be a case overview, maybe 2 to 3 paragraphs long. It's basically an executive summary, which includes the case dilemma. Keep in mind, this case overview is the piece of information that an instructor will probably review to decide whether or not they want to actually adopt your case for use in their classroom. The next section of a teaching note, the learning objectives. These should state what students should be able to do after analyzing and discussing the case. Make sure they're measurable, make sure they're realistic, and also make sure that the case itself provides enough information that the learning objectives can be achieved. Next should be pedagogy, and this section describes the audience for the case. For example, are they undergrads, grads, executive level, other? This section also lists any prerequisite material required before studying this case. And sometimes this section also includes a list of supplemental readings or materials that both instructors and students can read to get better context for the case or to understand a concept that's presented in the case. Next are the assignment questions, and these are the questions students must answer within their case analysis. And then the next section is the case analysis. And what this section does is often restates the assignment questions one by one, but under each question is listed multiple answers to that particular assignment question. It's really a good idea in a teaching note if instructors know what to expect from their students once they look at an assignment question. So that's what the case analysis tries to do and actually should do. Next is the teaching plan, and this is really how the instructor should allocate time in class for discussing different parts of the case. For example, how much time should they spend introducing the case? How much time should they spend breaking their class into groups and having them each tackle a different question? This just gives the instructor an idea of how to structure time. And then finally, the conclusion of the teaching note usually provides additional clarity about the case and also key takeaways that students should reflect upon after studying the case and discussing it. And once again, please make sure you log on to our competition website and read our document, How to Write a Teaching Note, that provides more details than I could fit on this slide. Okay. I thought it would be helpful to point out some common challenges people have when researching and writing case studies and teaching notes. For case studies, one of the major challenges is honestly the first few paragraphs of the case. Since the first paragraphs have to include a protagonist, it's important to identify that protagonist right up in the early part of the case, inclusive of their title, position, responsibilities, and background. That protagonist must ideally be one person. It's difficult to make multiple people a protagonist, so I would try to keep it to one protagonist. And the protagonist must be a higher level person in an organization, just because they will obviously be the person that is responsible for making a big decision or offering up a recommendation to the dilemma. The dilemma itself is sometimes challenging because it's unclear up front in the case. It's important to clearly describe what the dilemma encompasses so that students reading the case know exactly what questions to answer and what recommendations to make. And it also makes it easier for them as they read through the rest of the case, they kind of know what to be looking for if they're clear about the dilemma up front. Also, in those first few paragraphs, the specific time frame for the dilemma should be specified. And then be sure to stick to that time frame with all the other information in the case. And I'm saying this because, for example, if you are writing about something that occurred at the beginning of the COVID pandemic in March or April 2020, then you can't share data in your case from June or July 2020 because no one would have known about that. So you see what I mean about keeping true to your time frame. The final paragraphs are also sometimes a challenge in cases. Remember that the final paragraphs must restate the dilemma as well as the challenges facing the protagonist. And these final paragraphs should wrap up and conclude the case and the outstanding questions to be answered. And sourcing and citations are almost always somewhat of a challenge. Data and other information in the case must be cited with a complete EndNote source. And again, any graphic or visual must also have a source line included beneath it. When writing a teaching note, there are often some challenges. Assignment questions and the case analysis often are the challenges. Assignment questions, as I said earlier, should support each learning objective for the case. They must also be written to ensure a level of critical thought and thinking from students. In other words, they should require students to apply specific frameworks or concepts presented in the case. Additionally, remember, if an assignment question can be answered by someone who has not read the case, then that question is not appropriate. It's kind of a good test. And then the case analysis section, just remember answers to the assignment questions must be provided in this section. And also a variety of answers to the same question should be included because not every student will answer it the same. That ends this portion of the webinar on case writing tips and also some of the teaching note writing tips. Just want to wait and see if we have any more questions coming in. I don't see any yet specific to case writing. I think some of the questions have been answered. Wow, we must have been really clear in this entire webinar. That's fantastic. Okay, well, we really appreciate all of you who attended today. I think you'll probably have an advantage because you've heard all this great information, but as we said earlier, the whole webinar has been recorded. And when we wrap up today, it'll be about 24 hours before it'll be posted on our website, as well as everybody that attended is going to receive an email with a link to the recording. If you have any questions after this presentation, feel free to email me at info@wgipublishing.com. That is right on the screen right now in front of you. I'm happy to respond to you or get the question to the right person who can respond to you. And the other link on the screen is a link to the wrong website. It says DEI competition, so don't go to that link. If you go to wgipublishing.com/health tech competition 2024, you will find information about this competition. I'll just wait a moment to see if any other questions have come in. Okay. Again, thank you to our other presenters today, Pascal and Johan. Appreciate your information. And again, good luck to everyone. We really look forward to receiving your submissions by March 31st and your intent to enter forms by January 31st. This will end the webinar.
Thank you, everyone.
Thank you.